Xarelto is an anticoagulant that has actually 6 indications. One of the indications that I'd like to discuss today is the indications in patients with non-valvular atrial fibrillation. It's well established that patients with atrial fibrillation have a higher risk of stroke. And Xarelto has been shown in clinical trials to actually be a safe and effective option for physicians to reduce that risk. So the ROCKET-AF trial was the pivotal trial that led to the registration of Xarelto in patients with non-valvular AF. It was shown to be non-inferior to Warfarin, and it had a safe profile as well as far as its effect on major bleeding. Actually, it showed there were fewer events, fewer fatal bleeds and ICH, intracranial hemorrhages events that were seen in the ROCKET trial when patients on Xarelto compared to Warfarin. There are multiple aspects of Xarelto that make it a valuable option for physicians. As you know, patients on Warfarin have to watch out with their diet. They have to have their INR checked on a regular basis. Xarelto has a very consistent pharmacokinetic profile, can be taken once a day without all the drug interactions as well as the monitoring that's necessary. One of the things with Xarelto is that it's actually it has the most published data of all the 10A class with respect to real-world evidence, looking at both safety, efficacy, and adherence to the medicine. It's actually quite reassuring because the data is very consistent with clinical trials. In fact, over 91,000 patients have been enrolled in real-world evidence trials throughout the world. And what's been really reassuring to physicians is that the data is generally consistent to what was seen in clinical trials. So we're committed, both Janssen and Bayer, which are development partners for Xarelto, to continually monitor real-world evidence. At this meeting, there are about 19 abstracts being presented that speak to the whole spectrum of safety, efficacy, and persistence to the medicine. And again, it's been very encouraging that it's reinforced that safety and efficacy and persistence profile. The majority of patients are managed by primary care physicians. Again, the once daily, administration, the safety and efficacy profile that's been really generally consistent with the clinical trials. So it doesn't require any special monitoring. So actually the majority of patients that are with non-valvular AF that are treated by internists and general practitioners. Some of the interesting research that's being presented at the American Heart Association is looking at medication adherence as well as patients with worsening renal function. And the reason why these are 2 challenges that patients can encounter, and the reason why it's important is patients with non-valvular AF frequently have comorbid diseases like diabetes, and they can encounter worsening renal function over time. And the reason why this is important is because patients with worsening renal function have a higher risk of stroke and a higher risk of bleeding on an oral anticoagulant. So this is why it's important to understand the safety and efficacy of the drug. And in the subset analysis of ROCKET, in about 3,000 patients with worsening renal function, it was very reassuring to see that actually the stroke rate on Xarelto compared to Warfarin was actually lower, with no differences in major bleeding. And this was reassuring that Xarelto remains a valuable option for these patients. For medication adherence, patients don't always take the medication as prescribed, and in order to prevent life-threatening or disabling stroke in patients with non-valvular AF, it's very important for patients to take the medication as prescribed by their physicians. And in some studies that were presented at this meeting, and also some studies published in the past, adherence and persistence to the medicine was much better than it was with Warfarin or with a twice-daily medication like, for example, dabigatran. There was also a study published recently in the Canadian Journal of Medicine that surveyed patients themselves and asked them on different oral anticoagulants whether they were taking them, how they were taking them. And actually about 1 in 3 patients that were on twice daily blood thinners actually were taking them only once a day. And this is not necessarily new findings in the cardiovascular field. I think from hypertension and other studies, it's well known that taking medications more than once a day, as you increase the frequency of administration, the adherence rates go lower. I mentioned the rocket renal analysis, and obviously that's a clinical trial. But if you look at real-world data, for example, also at this meeting, an abstract was presented from our post-marketing safety study. This was an FDA-mandated study that looked at about 30,000 patients on Xarelto. And if you take the patients with impaired renal function, in that subset, about 6,000 patients, the bleeding rate was actually consistent with also with the clinical trials. So again, reassuring that clinical trial data gives us important information, but we're continuing to monitor the real-world data, and it's actually very consistent, and we're very encouraged by that. Additional research, though, is necessary to understand the effect of this lower adherence on safety and efficacy long-term with daily blood thinners. Xarelto is a valuable option because it is a once-a-day medication, and it seems to be associated with better persistence on the medication. In addition to having the most real-world data, we're very committed in exploring different uses for the medication. The Explorer program, the Global Research Explorer program, by the time it's done and completed, there'll be about 275,000 patients enrolled. And we're exploring the use of the medication in new indications. About 6 new indication trials are ongoing worldwide. So we're very much looking forward to looking at Xarelto and trying to provide important efficacy and safety data in potentially new populations with acute coronary syndromes, coronary artery disease, peripheral vascular disease. So there's a lot more to come in the future. We're very committed to providing important data to physicians to guide their treatment of the patients. The 275,000 patients is made up of multiple clinical trials designed to look at whether the drug is efficacious and safe in some new populations outside of the indications that are there, in addition to doing real-world studies. So I think it's very important to do these studies. Again, this could be, to provide important data to physicians so they can really better inform the care of patients.